Thank you for choosing Sharp Home Infusion Services for your home IV therapy needs. In this video, we will teach you how to prepare your TPN solution. TPN stands for Total Parenteral Nutrition. When you cannot get enough of the nutrients your body needs through eating alone, TPN can provide these nutrients. TPN supplements your nutritional needs through a vein rather than through your digestive system. As always, wash your hands and prepare your work area, as described in video 1. Store your TPN in a refrigerator at a temperature of 35 degrees Fahrenheit or 1.6 degrees Celsius. Check the TPN bag label to make sure the name and mixture are what your healthcare provider ordered for you. If you think there is a mistake, call your home infusion nurse or pharmacist. Ideally, you will remove the TPN solution from the refrigerator 1 to 2 hours before the infusion to bring it to room temperature. Do not warm your TPN by placing the solution in direct sunlight or by soaking it in water. You will need to gather and organize these items: a clean barrier, the TPN bag, syringes and needles, alcohol prep pads, 2 multivitamin injection vials, other additives such as insulin if ordered, and a red Sharps container for discarding used syringes. Be sure to check the TPN solution bag for any signs of contamination or leaks. Do not use the TPN if you notice any signs of cloudiness, change in color, particles, leaks, or fat separation. Your TPN may be clear, or if fats are added, it will look milky. Check the expiration date on the label. If it's expired, call your Sharp Home Infusion nurse or pharmacist. The TPN formula is typically made up of protein, sugar, and often fat. It also contains electrolytes and trace minerals. The vitamins normally found in food are essential for your health, so the TPN preparation includes adding a multivitamin injection, or MVI, to the TPN solution. The vitamins come in 2 separate vials and must also be kept refrigerated. Check the expiration date prior to use. Because the MVI is only good for 24 hours once open, you need to add these multivitamin vials to your TPN bag right before you use it. Place the clean barrier on the clean flat surface you prepared earlier. Lay out the TPN supplies neatly on a clean pad. Open 5 or 6 alcohol wipes by tearing off 3 edges on the package. Being careful not to touch the wipe inside, peel back the tops and set the open wipes down on your clean barrier. Remove the syringes from their wrappers. Push in the plungers to remove any air and place them back on the clean barrier. If the solution you checked earlier looks okay, place the bag on the clean barrier. Now that everything is in place, you can begin to add the MVI to the TPN solution. First, clean the tops of the 2 MVI vials with alcohol wipes. Use the empty 10 milliliter syringe to draw up the entire contents of both 5 milliliter vials. Pull back 5 milliliters of air into the empty syringe. Insert the needle into the first multivitamin vial. Turn the vial upside down and make sure the needle is below the fluid level. Inject 5 milliliters of air into the vial. Withdraw the entire contents of the first vial. Repeat these steps for the second vial. Clean the injection port of the TPN bag with an alcohol prep pad. Inject 10 milliliters of MVI into the TPN bag. If you require other additives, repeat the same steps you took with the MVI. Clean the container tops. Draw the correct amount into a new syringe, wipe the injection port, and inject the additives into the TPN bag. If you require medications such as insulin or thiamine, you will follow a slightly different set of steps, and your home infusion nurse will teach you how to add it into your TPN. Be sure to properly discard the used syringe into the Sharps disposal container. Once your TPN solution with MVI and medications is ready, you'll follow the process demonstrated in video 4 of this series. We hope you found these instructions helpful. Thank you again for choosing Sharp Home Infusion Services.